Life is normalizing somewhat. Level 3 will see sectors like manufacturing, construction, mining, and financial services fully opened. Alcohol will be sold, people will be allowed to exercise at any time during the day, but not in groups, and people will be allowed to worship, but not in groups bigger than 50. But with all the freedoms, a huge risk of increased infections.
Many of the restrictions have been lifted. We can buy alcohol, we can go shopping, retail is open on quite a large scale. Alcohol is now available, and that means that the nature of lockdown has changed, and it also suggests that it's going to be difficult to enforce in terms of those who don't comply with the set regulations, as so many people get their lives back together. Let's hope, and it's nothing more than a hope, that the simple practices of masks and social distancing remain as normality starts to resume.
The COVID-19 ball is now in our court.
What we need going forward is essentially three things. We need people to understand that in order to protect ourselves and other people from COVID-19 and to protect the healthcare system, we need to avoid large crowds as much as possible. We need to practice social distancing and all of the hygiene measures like masks and hand washing. And most importantly, we must protect the most vulnerable in our society. And those are not only the elderly, but people with things like hypertension, people who are survivors or currently suffering from cancer, people who have other kinds of comorbidities linked to HIV or TB or lung infections. And all of those people in society deserve us to be as careful as possible and to be as protective as possible of them in the workplace, in schools, in all aspects of life, even when we go to the grocery store.
As more sectors open, the lobbying continues, from restaurants to beauty and leisure. And of course, the smokers. Natasha Piri, SABC News, Johannesburg.